We will look at the staging of all gynecological cancer. First, we'll start from endometrial cancer. It is called well differentiated or grade 1 when the number of undifferentiated cells are less than 5%. 5 to 50%, it will be moderately differentiated. Poorly differentiated if more than 50% of cells are undifferentiated. They can also be classified as type 1 and type 2. In type 1 cancer, you see a mutation of KRAS gene and PTEN gene. In type 2, you see a mutation of P53 gene. Estrogen has association with type 1 cancer, with most commonly seen the cases of obese, white, young females. There is no association of estrogen and type 2 cancers. Both will have adenocarcinomas, type 1 and 2, adenocarcinoma 3. Also, type 2 can also have clear cell tumors or papillary serous type. It has a comparatively better prognosis than type 2. Then we have a surgical staging for endometrial cancers. If the myometrium only is involved with less than 50% of involvement of myometrium, it is stage 1. More than or equal to 50% of myometrium is involved, it will be stage 1B. In stage 2, we have extension of cancer to cervix. Then uterus is involved, cervix is involved. If cirrhosis is also involved, it will be stage 3A. If it involves vagina, stage 3B. If it involves lymph node, it will be stage 3C. Then in that only, if it involves pelvic lymph node, it will be C1. If it involves para-aortic lymph node, it will be C2. And then in 4, we have METs. It can be regional METs or it can be distant METs. Then we have cervical cancers. Cervical cancer can be low cell or high cell initially. In situ 1 and 2. 1 is less than involvement of 1/3 of total thickness. 1/3 to 2/3 is involved here. Then more than 2/3 is involved. Full thickness is involved with intact basement membrane. CIN1 is low cell, rest all are high cell. Then you have staging of cervical cancers. Now, depending on depth, only up to depth of 4 centimeter or maximum 4 centimeter we consider is type 1A. That is, if it is less than 3 mm and 3 to 4 mm, A1 and A2. If it is all more than 5 mm, it will be, depending on size. If it is less than 2 centimeter, 2 to 4 centimeter, more than 4 centimeter, it will be 1B. Type 2 will involve upper vagina, whereas stage 2 will involve lower vagina. That is, stage 2 is upper vagina, stage 3 is lower vagina. Again, if the size is less than 4 centimeter, we have A1. If it is more than 4 centimeter, we have A2. Then in type 2B, we have involvement of vagina and parametrium. Stage 3 involves lower vagina with involvement of pelvic node will be B. Pelvic wall. There is no involvement of pelvic wall in A, whereas in B if there is involvement, and C if there is lymph node involvement. 1 will be pelvic lymph node, 2 will be para-aortic lymph nodes. Stage 4 is METs. Then we have ovarian cancers. Ovarian cancer can be either epithelial type, germ cell, or sexual stromal cell. We have surgical staging. If there is only involvement of one ovary, it will be 1A. Involvement of both ovaries with intact membrane, 1B. If the capsule is ruptured intraoperatively, C1. Preoperatively ruptured, it will be C2. If ruptured with malignant ascites present, it will be C3. If the mass tumor extends to fallopian tube and uterus, it will be extension is 2. If it is to fallopian tube and uterus, A. If it involves bowel and bladder, even pelvic lymph node will be considered 2B. If it involves retroperitoneal lymph node, it will be stage 3. Mets are stage 4. Then we have, lastly we have vulval cancers. Depending on depth, less than 1 mm, but size is also less than 2 cm. If it is more than 1 mm and more than 2 cm, 1 A and B respectively. In stage 2, you have involvement of lower vagina or anus or urethra as such. There is no lymph node involvement. If there is lymph node involvement, with or without adjacent structure involvement, it will be stage 3. In the upper vagina or urethra or anus involved with positive lymph node spread, it will be stage 4. If it is just superficial inguinal lymph node, A. If it involves pelvic lymph node, it will be 4B.